Skin cancer is the most common form of cancer in the United States, which is really not surprising when you think about it, because the skin is the largest organ in the body. Over the past 31 years, more people have died of skin cancer than any other cancers combined. Melanoma, which is a form of skin cancer, is defined as a malignant tumor of melanocytes. Melanocytes are cells that produce the dark pigment melanin, which is responsible for the color of our skin. The majority of the cells are found in the skin, but can also be found in other parts of the body, including the bowel and the eye. Therefore, melanoma can occur in any part of the body that contains melanocytes. Even though melanoma is less common than the other skin cancers, it is much more dangerous and causes the majority of the skin cancer's death. The Skin Cancer Foundation has estimated 123,590 new cases of melanoma that will be diagnosed in the United States this year alone. So the importance of early detection cannot be overestimated. When melanoma is found and treated early, the chances of a long-term survival are excellent. And the good news is that when the early detection survival rates, early detection survival rates have improved steadily in the recent years, and 85% of diagnosed patients will survive a long-term life. The first sign of melanoma is often a change in the size, shape, or color of an existing mole or the appearance of a new mole. Since you're able to see most of primary melanomas on the skin, there's a good chance of detecting the disease in its early stage. When diagnosed early, the most common and effective treatments are surgery, chemotherapy, and Harmon. Because melanoma is now the fastest growing cancer in the United States, and one person dies from melanoma every hour, you're probably wondering what causes melanoma and who is at risk. Here are some common causes. One is exposure to ultraviolet radiation, which is like blistering sunburns at any time of your life. So each of us need to stay out of the sun during the midday hours of 10 a.m. to 4 p.m. You should also wear protective clothing, which includes a hat, the hat that shades our head, ears, and neck, shirts with sleeves to cover our shoulders, and pants to cover our legs. It is also super important to wear sunscreen every day with SPF of at least 15 that protects against both types of ultraviolet radiations in the sun's rays, which are UVA and UVB. Fair skin that does not tan tends to burn or freckle. Eye and hair color can also be important factors of assessing your risk. If you have blue or green eyes, red or blonde hair, it puts you at a greater risk. Also, like many other diseases, personal or family history and predisposing conditions can put you at greater risk of developing melanoma. Having one or several risks for melanoma does not mean you will definitely develop melanoma, but it does mean that you have a greater chance than someone who has no risk factors for the disease. It is really important to know your risk factors so that you can take steps to reduce your chances of developing melanoma or increase your chances of finding the disease in its early and more treatable stages. One such important step is examining your skin regularly and having your doctor check your skin during all other health examinations, or at least once a year.